welcome to our Public Safety, Finance, and Strategic Support Committee. If we can get a roll call, please.
Jimenez.
Present.
Mahan.
Here.
Jones.
Present.
Arenas. Perales.
Here.
We have a quorum.
Thank you very much. All right. And our first order is a review of our work plan. Does any of the members of the committee have any items they wish to see added, dropped, or deferred, or staff? Not seeing any. If we can get a motion and a second.
So moved.
We've got
Second.
a motion and a second to approve our work plan. If we can get a roll call vote, please.
Jimenez.
Present. Yes.
Mahan.
Aye.
Jones.
Aye.
Arenas. Perales.
Aye.
Thank you.
All right, thank you. We have nothing on consent. So that takes us down to item D1, which is the Sexual Assault Response and Strategy Annual Report. I believe we have Chief Tyndall here with us. And we've actually got quite a crew here with us to report, so I'll turn it over. Chief, you are on mute still.
Good afternoon, and thank you. Actually, nothing from me. I'm here to answer questions afterwards, and so we're going to get straight into the presentation from staff.
Great, thanks.
Good afternoon, everyone. My name is Angeli Montessa, and thank you for having me here this afternoon to present on the Department's Sexual Assault Response and Strategy Annual Report. The annual report will review the Sexual Assault Investigations Unit's strategy, goals, and plans. We will provide an update on sexual assault related work items, present an overview of the distinctions between the Sexual Assault Investigations Unit and the Special Victims Unit since its creation in February of 2020, then proceed to provide reports for the Sexual Assault Investigations Units and the Special Victims Unit regarding sexual assault topics as it pertains to each unit. Then we will close with a COVID-19 impact report and as it relates to sexual assault. I now introduce to you Lieutenant Jaime Jimenez of the Sexual Assault Investigations Unit to briefly go over the strategy, goals, and plans of the Sexual Assault Investigations Unit.
Thank you, Angeli. And before I begin, thank you, Council and Chief Tyndall and those from the City Manager's Office. I also want to thank the members of the YWCA who joined us, Lindsay Mansfield, Cynthia Melchor, and Rachel Wong. And hopefully we'll have some time for them to comment as well and answer some questions. But to begin with, I want to talk a little bit about strategy that we employed in 2020 and we continue into 2021. If we can summarize it in 3 words, it would be timely, consistent, and thorough. And that's how we regard our investigations in sexual assault cases. We've seen some good byproduct of those values. Essentially, we have smaller caseloads. We refer more cases to the DA's office. We believe and we're told that our cases are increasingly stronger, and it's increasing productivity in our workforce, in our investigations. Some of the process and policy changes that we've employed is adding standard operating procedures to the unit, some duty manual revisions, and we intend to revise the unit guidelines. A lot of what we're doing in our success is based on training. There's formal training, some listed here for our detectives, and some informal training. One of the most important things that we're doing currently is due to COVID, sending out the SAIU newsletter. It's essentially a monthly publication that we distribute via email to officers throughout the organization to inform them about things we're seeing, whether they're good or bad. So we're reinforcing the positive and trying to curb things that can be improved. Some of the improvements that we've made also is better selection of disposition codes and better utilization of our partners, including the YWCA Community Solutions and the District Attorney's Office, amongst others. you wouldn't mind, next slide, Angeli, please. Some of our goals, obviously, increased reporting is the main one, and prevention. We do prevention through prevention, education, intervention, and enforcement. And moving forward, and what we've been doing is we plan to work closer with Lieutenant Anderson in SVU and Lieutenant Lang over in Family Violence Unit. We believe that our 3 units share common goals and interests, so we believe working together is a smart thing to do. We also want to improve data sharing going forward and work more closely with a lot of different groups, but specifically the API community. And some of the data that we're going to present today will demonstrate why. At this time, I'll return it back to you, Angeli. Thank you very much.
The next section provides updates on sexual assault work items. We will be focusing on the items that are currently in progress and providing an update on one of the implemented items. The following sexual assault related work items are listed below the responsible unit. SEIU partnered with the YWCA of Silicon Valley to provide a sexual assault education and training program for youth and middle and high school to understand consent, refusal, and healthy relationships. Due to the pandemic, though, in-person education was no longer allowed. And in addition, the material being presented in this program is proprietary and does not allow for remote learning. This program is in the process of being extended, and once the program is complete, a research and evaluation company will provide an evaluation of the sexual assault education and training program. Trauma-informed care training for all officers is in progress and has been implemented for SEIU personnel who have been trained alongside approximately 120 members of the Bureau of Investigations detectives, sergeants, and lieutenants. The Child Advocacy Center, still in progress, will house together under one roof in a facility key services, which is specifically designed for children's needs. The SEIU lieutenant is working with the Santa Clara County District Attorney's Office, ADA, to formalize 3 separate MOU agreements related to the CAC. Once the MOUs are fully executed, the San Jose PD's Child Interview Center will co-locate with the county at the Child Advocacy Center. In February 2020, the Sexual Assault Investigations Unit met with the Office of Gender-Based Violence for its first meeting to develop a plan for the ethnic-based agency build-out project. The Office of Gender-Based Violence has already implemented prevention contracts related to intimate partner violence. Many of the vendors implemented evidence-based curricula already focused on youth or specific cultural communities such as Vietnamese, East Indian, and Latinos. The next step of the project is to meet to further develop upon the list of agencies contracted with the Office of Gender-Based Violence and to summarize each agency by main contact person, ethnic focus of the agencies, and languages spoken. A joint follow-up meeting between the PISPIS Committee and the Santa Clara County Children, Seniors, Families has been scheduled. The substandard housing study went out to RFP, the request for proposal, in October of 2020. There were no academic institutions that were interested in taking on the study. The RFP was not fulfilled. Research into why the RFP was not taken on revealed that the study was too broad or too broad to complete under the COVID restrictions in place at the time, and that the RFP was put out for bid. The study is currently under review to help narrow down its focus. I will be touching upon the Vigilant Parent Initiative program in future slides. And the Domestic Violence High-Risk Response Team is currently implemented as a pilot through June 2021. And lastly, the Western Division is currently conducting a pilot project for strangulation evidence collection. The next 2 slides provides an update on the implemented intersectionality tool between sexual assault, domestic violence, and human trafficking. Upon the tool's implementation in January of 2020, the department received 2,195 supplements. Excluding January as the outlier, the average number of reports received per month since its implementation is 199. 200 of those reports were forwarded to SEIU and followed up on. 701 reports went to the human trafficking detail. All 701 were reviewed by the investigators, and 31 of the reports required further follow-up, which is currently in progress. It is important to note here that not all 701 reports were confirmed human trafficking cases and provided indications to the Human Trafficking Task Force that further refinement of the human trafficking section of the supplemental tool is needed to better capture true cases of human trafficking, which is currently under review. The next section will provide an overview of the Sexual Assault Investigations Unit and Special Victims Unit. Prior to February 2020, the Sexual Assault Investigations Unit was comprised of the General Sexual Assaults Team, Child Exploits Internet Crimes Against Children Detail, the Megan's Law 290 Team, and the Human Trafficking Task Force Team. The crime of sexual violence encompasses several unique categories of abuse, and each of these categories requires a specific type of investigative expertise. As a result, the Special Victims Unit was created in February 2020 after next step recommendations were made in the November 12, 2019 City Council special meeting regarding San Jose's sexual assault response and strategy. Post-February 2020, SAIU is now solely responsible for general sexual assault crimes, and the Special Victims Unit is now responsible for investigating illegal possession, transmission, and production of child sexual abuse material, human trafficking, and sex offender registration violations. The new unit now houses the Internet Crimes Against Children Task Force, Child Exploits Detail, Human Trafficking Task Force, and the Megan's Law 290 unit, led by Unit Commander Lieutenant Brian Anderson. This slide provides clarification for the staffing and investigative responsibilities of SAIU and SVU. Moving forward in this presentation, topics related to rape, child molest, indecent exposure, lewd and lascivious, and sex crimes except for obscene matter will be addressed under SAIU. Topics regarding Penal Code 311, obscene matter, 288A, lewd and lascivious with under 14 years only when the perpetrator is in a position of trust and as it relates to 311 Penal Code, in addition to offenses related to human trafficking, will be addressed under SVU. Now moving forward with the SAIU annual report. The department is committed to ongoing monitoring of measurable outcomes and proactive coordination with law enforcement agencies and community service providers to ensure that our approaches are aligned to advance our shared goal of eradicating sexual assault and intimate partner violence. SAIU's general efforts have been to maintain open lines of communication and promote coordination between other agencies and providers by participating in collaborative committees and partnerships, as well as the establishment of standard operating procedures, also known as SOPs, to ensure alignment around specific outcomes consistent with best practices, and to ensure that the members of SAIU are providing the best possible service to our survivors and the community. The SOPs aim to provide timely, consistent, and thorough investigations while reducing failure to adhere to best practices. Slide 15 represents a 5-year count of SAIU cases involving a sexual assault. Note the 18.5 decrease from 2019 to 2020 most likely is due to the onset of COVID-19 in 2020, resulting in underreporting, and not necessarily an indication of a decrease of sexual assault incidences. Slide 16 is a 5-year count of offenses, and remember that cases can involve more than one sexual assault offense. Note again that the dip in count in 2020 is more likely due to underreporting, and that we foresee an increase of delayed reports later in 2021 or next year. Administrative clearance codes were strictly monitored, resulting in decreases in the use of codes that were administrative in nature. This change is evidenced in the 70.9% decrease in the use of Disposition Code L, Law Enforcement Reject. The strategy SAIU members are employing is to conduct thorough investigations, which result in the identification of the suspect. The detectives then provide the case to the district attorney's office to determine if a criminal filing is warranted. At the same time, the detectives are using a survivor-centered approach while connecting the survivors with services to aid in the healing process. Per next step recommendations made in the November 12, 2019 City Council special meeting regarding San Jose sexual assault response and strategy, changes were made to the internal statuses and began to eliminate the use of the Disposition Code K, lack of investigative resources. From year 2016 to 2020, the amount of cases closed with Disposition Code K decreased from 531 to 4. A 99.2% decrease in the use of Disposition Code K. As a solution or alternative to the use of the internal status code K, detectives and sergeants now have the ability to use G, lack of victim cooperation, attempts made or no contact, and H, victim requested closure. Furthermore, with recent changes in how SEIU detectives and sergeants utilize internal status codes and investigate cases, the unit is also seeing a decline in the use of internal status codes G and H. The 5-year count of clearance by arrest or citation showed an increase of 8.5% from 2019 to 2020, and overall a 37.6% increase over the last 5 years. SEIU members firmly believe holding the offender accountable will help prevent future sexual assault and aid in the healing of the survivors. Slide 20 distinguishes between adult arrest cited and juvenile arrest cited. Slide 21 provides a heat map and count of arrests cited by age. Councilmember Arenas, acknowledging your request to see all ages rather than separate 14 and under, we've included all arrestees, juvenile and adult, in this heat map. For juvenile arrests, we see concentrations in this 13 to 17-year age range. And for adults, we see concentrations among the 25 and 28-year-olds and roughly the 32 to 40 age range. Slide 22 provides a heat map summary of arrests cited by ethnicity. Again, the juvenile arrests are cited encompasses all juveniles aged 14 and under. The top 3 ethnicities for adult arrests and cited are Hispanic, Caucasian, and African American. Collectively, Asians make up 9.3%. The same top 3 follows for juvenile arrests are cited, but Asians collectively at 11.7%. Slide 23 is a count of adult and juvenile survivors. As previously stated, the reduced number is most likely due to the COVID-19 impact, and we do foresee an increase in delayed or historical reports later in the 2021 or next year. Slide 24 is a heat map and count of survivors. Following the same methodology of the arrest or cited data, we also included all ages as requested in February and did not separate out 14 and under. So you can see better that the concentration of survivors are 12 to 17 years old. Slide 25 is a heat map and summary count of survivor ethnicity. The top 3 ethnicities among adult survivors are Hispanic, Caucasian, and African American. Collectively, adult Asian survivors make up 13.5%. Again, re-emphasizing the issues of underreporting among the Asian community. The same top 3 ethnicities are among juvenile survivors with 9.8% collectively Asian. Councilmember Arenas, addressing regarding the offender and survivors, we could not extract and produce from February's report till now. However, we did do an analysis for January 1st, 2020 through December 31st, 2020 that was completed to count the type of relationship a victim had to the offender for each case. The chart presented here summarizes the generalized categorical count of all victim relationships to offender for 2020, showing that 53% of survivor to offender relationship revealed that the offender was a family member. Further breaking down familial relationships, the majority indicated that 17.2% was other family member, followed by 16.8% where the victim was a child. Granular breakdowns of the numbers in this chart are provided in the memo. Continued location analysis by zip code was still attached to the memo under attachment A, and you will find the count of arrests cited and survivor zip codes and location of incident by category provided in the same attachment. The following lists SEIU efforts to improve services to survivors and our community. The 5 main services include the department's crime prevention unit, partnerships with YWCA's Improving Criminal Justice Program, sexual assault education program for middle school and high school aged youth, and its clinical counseling program. And lastly, SEIU's newsletter from the bullpen, which was created as a way to communicate with the department as a whole and to provide up-to-date case law, policies, and guidance regarding sexual assault investigations. The newsletter includes input from the Santa Clara County SART Committee to provide feedback and investigative tools to patrol officers. Moving forward, the data analytics and prevention and intervention measures are key strategies that are very valuable to SAIU's work. In order to make sound decisions, SAIU leadership rely on data provided by our crime and intelligence analyst. The lieutenants assigned to SAIU, SVU, and the Family Violence Unit, FVU, collaborate to provide consistent services to our community and department through the data provided by the crime and intel analyst. Additionally, the analysts assist the Vigilant Parent Initiative trainings and various other department needs. While SAIU personnel do an excellent job on enforcement, the unit relies upon the San Jose Police Department's Crime and Prevention Unit, CPU, and the YWCA to carry out prevention and intervention measures. SAIU members will work more closely with the Crime Prevention Unit and the YWCA to provide a data-driven approach to educate those who live in areas prone to experience sexual assault. Lastly, SAIU personnel recognize the disparity in the reporting of sexual assault in the Asian community. We recognize that the reporting of sexual assault is seemingly underreported in the Asian communities. In both cases of data analytics provided by the Crime and Intel Analyst and the prevention and intervention services provided by the Crime Prevention Unit, continuing to increase the department's capacity in these areas related to sexual assault as resources allow would support SAIU's strategic and multidisciplinary approach. SAIU personnel will work more closely with all ethnic-based agencies with an emphasis on the Asian service providers to ensure that we have a more equitable approach to education and to intervention in those communities. The following section addresses the Special Victims Unit report, which covers crimes against children. Slide 31 highlights Penal Code 311 obscene matter, displaying an 18.3% increase from 2019 to 2020. This slide summarizes the count of adult and juvenile arrests cited involving 311 Penal Code obscene matter. To better understand the 12 to 17-year-old age range of arrests cited, please take into account that 5 of these cases were cyber tips for the possession of child sexual abuse material, and 5 cases involved the distribution of material, and 5 included extortion. 5 of the cases also generated 14 citations during events where children in schools were distributing nude photographs to the whole school. All 40 of the arrests cited involved some type of extenuating circumstance. Majority of arrests for possession of child sexual abuse material do occur among males 18 and up. This slide displays survivors of 311 Penal Code obscene matter. Please note that when survivors are classified as an adult victim, it's when the report was initially made. It's an indication of historical or delayed reporting, particularly for offense 311 obscene matter. Nevertheless, numbers for both arrests cited and survivors indicate the importance of educating the community, especially parents, on basic social media and technology how-to, prevention, awareness, knowing how to talk to your child about protecting themselves online, and recognizing when a child may potentially be in danger. With regards to child exploitation cases, SAIU handles the bulk of child molestation cases. SVU does investigate child molestation cases in conjunction with possession of obscene matter, CSEC cases, or in sensitive cases involving a person who is in a position of trust within the community. These instances are handled just as an SAIU investigator would handle a child molestation case. Investigators actively refer survivors to partner agencies for counseling services, conduct safety planning, and assist with shelter. SVU investigators uses the Child Interview Center, the San Jose PD's Family Room, and the in-house YWCA advocate when appropriate to support survivors. It is important to understand that the Internet Crimes Against Children unit of SVU also investigates cyber tips. A cyber tip line report provides the public and electronic service providers with the ability to report instances of online enticement of children for sexual acts, child sexual molestation, child pornography, child sex tourism, child sex trafficking, unsolicited obscene materials sent to a child, misleading domain names, and misleading words or digital images on the internet. The National Center for Missing and Exploited Children, NCMEC, continuously reviews these cyber tip line reports to ensure that reports of children who may be in imminent danger get first priority. After NCMEC's review is completed, all information in the cyber tip line report is made available to law enforcement and more specifically ICAC task forces. This slide displays the 107% increase of cyber tip reports from 2019 to 2020, noting April and May of 2020 to be the highest number ever received per month in all the years that the ICAC unit has been in existence. From the cyber tips received, we also see a 50% increase in the online enticement of children and an 86% increase in the possession of child sexual abuse material. When the COVID-19 pandemic began, there was a legitimate concern that the local shelter-in-place orders could negatively impact our community and cause an increase in sexual assault crimes. The most significant impact the pandemic and shelter-in-place had on SVU was the dramatic increase in cyber tips. The period between January of 2017 and January of 2021 illustrates how 2020 stands out from previous years, with 1,053 cyber tips in April of 2020 compared to the 289 in April of 2017. The year-to-year increase further highlights the negative impact of shelter-in-place orders, showing a 309.7% increase in cyber tips in April of 2020 compared to April of 2019, and a 354.3% increase in May of 2020 compared to May of 2019. When local shelter-in-place orders went into effect in early 2020, CSAM, or child sexual abuse material, skyrocketed, and 2020 has continued to remain higher than previous years. With more of our youth at home and online, the opportunities for sexual predators to make contact with our children have grown. The increase in cyber tips and possession of CSAM illustrates the unfortunate fact that a child who is online without vigilant supervision is at risk of being contacted by a sexual predator. In response to the increase in cyber tips and online distant learning trends, SVU's education and outreach programs were able to pivot to online learning and outreach. This will be touched upon in the providing services to victims slide under the Vigilant Parent Initiative. The bifurcation of SBI, CAC, and Child Exploits detail the Human Trafficking Task Force and Megan's Law Unit from the Sexual Assault Investigations Unit to form the Special Victims Unit has created the opportunity to be a force multiplier in combating sexual violence and aligning best practices between the department and community service providers. The creation of SVU has facilitated an increased collaboration between governmental agencies and community service providers committing to serving members of survivors of sexual violence. Furthermore, SVU has continued to build upon its commitment to education and outreach through the Vigilant Parent Initiative, Internet Safer Day in February, and online educational campaigns and social media posts. Despite statewide and countywide COVID restrictions and over a 100% increase in cyber tips, proactivity was maintained regarding ICAC traveler cases from 2019 to 2020 and increased a 100% with HT traveler cases in 2020. Furthermore, human trafficking hotel, rescue, and John operations increased 100% during 2020 from 2019 operations completed. The human trafficking hotel rescue John operations were supported by the Office of Violence Against Women grant and allowed the human trafficking unit to bring in officers from other units on overtime to assist with the operations. The domestic violence, sexual assault, human trafficking assessment template was successfully added to the domestic violence reporting in January of 2020. The template identified 701 potential survivors, and after being forwarded to the unit for review, that result of 31 being assigned for follow-up was for investigation. The purpose of the intersectionality form was to ensure that survivors of intimate partner violence identified as survivors of human trafficking could be connected to the appropriate community service providers by the initial report officer or the assigned detective conducting an investigation. An audit of the intersectionality form undertaken late in 2020 revealed for the opportunity for system improvements that could increase the unit's probability of identifying and arresting traffickers and automating analytical data. In conjunction with the department's video unit, the Human Trafficking Unit is completing a training video for patrol on recognizing human trafficking. One of the speakers, known from L of Stars, provides the survivor's perspective to be rolled out in the spring of 2021. Human trafficking members have participated also in the Human Trafficking Conference, Trafficking Streams, and other conferences by Shared Hope and the Wizen Trafficking Summit. Human trafficking members are taught at YWCA's advocate training and participate in updating the Santa Clara County Human Trafficking Protocol. Members have been actively participating in the Asian Pacific Islander Human Trafficking Outreach Campaign, which includes regular coordination with the South Bay Coalition to End Human Trafficking, Community Solutions, Asian Americans for Community Involvement, and MATRI. And lastly, the Vigilant Parent Initiative program is geared towards educating the community and parents on basic social media and technology how-tos, prevention, awareness, and knowing how to talk to their children. This program kicked off its first interactive learning class in September of 2019 with Eastside Union High School District in San Jose. Since then, the program has received an upsurge in demands for presentation. So far, 15 schools and organizations requested and received a presentation, and tech-related information was disseminated since March of 2020 via social media and has reached 13,000 unique users. For Human Trafficking Awareness Month in January 2021, the Human Trafficking and SVI CAC units collaborated to push a month-long social media campaign to bring awareness to the issue of human trafficking in the context of online grooming and recruitment methods, with a goal of 31 daily posts reached. SVU is a new unit with a greater ability to conduct proactive investigations to eradicate sexual violence. However, recent crime trends are increasing the unit's workload. The increase in cyber tips is indicative of the growth of CSAM, and every report of CSAM must be investigated. The hundreds of escort and massage parlor ads displayed weekly in San Jose, combined with an evident underreporting in the API community, suggest a need to increase our human trafficking investigative and outreach capacity. While the unit's investigators and advocates provide excellent service for victims, after a case is received, the volume of work required by complex human trafficking cases hinders investigators from having enough time to conduct proactive investigations, outreach, and provide timely data sharing with our community-based organizations. As with SEIU, SVU would also benefit from continuing to build the capacity of the Crime Prevention Unit to conduct education and outreach activities in conjunction with the Vigilant Parent Initiative as resources allow. SVU would benefit from increasing forensic and analyst staff capacity as resources allow to carry out complex tracking of money tied to human trafficking, complete the continual Vigilant Parent Initiative curriculum updates, and assist with our continual data sharing with our community-based organizations. Moving forward, we'll highlight short COVID-19 impact report. As you can see here, this is a total count of reported cases of 2019 versus 2020 in comparison. You'll note that the highest ranges were between April through July of 2020. The highest cases, were between May and July of 2019, and you see the dip between April through June of 2020. Note that you'll see the continual decrease below the 2019 years. This is indicative of underreporting during the 2020 COVID year. Next is a total count of domestic sexual assault cases with a 2019 versus 2020 comparison. Note again that you'll see 2019 highlighted in January, October, November, and December regarding domestic 261 PC and domestic 220 PC. Note the high ranges of March of 2020, as well as July 2020 and November 2020. Slide 44 notes the total count of child molest cases comparing 2019 versus 2020. Note that in May of 2019, you'll see an increase in 87 versus May of 2020 at an all-time low of 25. Note again, this is indicative of underreporting in 2020, which we will foresee an increase of delayed or historical reporting later in 2021 or next year of 2022. In closing, I will lead to Lieutenant Jaime Jimenez or Lieutenant Brian Anderson of the SVU unit to address any questions or concerns from the council.
All right. Thank you very much, Angeli. Very thorough report. We will go over to our members of the public first. And if you're calling in, please use *9 to raise your hand, or if you're joining us on Zoom, you can just use the raise hand function. All right, and first up we have caller with last 4 digits 8357.
Hi, this is Paul Soto. I was the victim of a sexual assault on March 3rd. Officer Vieira, batch number 4828, responded. I was a victim of a sexual assault while I was wearing a towel, the most vulnerable position that a man can be in. I have reported it to the YWCA to help me. I need some counseling that triggered some PTSD from past victimizations. I have received no phone call from nobody. I got evicted from that home as a result of my reaction to being sexually assaulted while I was in a towel. My reaction, according to them, was aggressive. But if I was a woman, it would be strong. Because when you have no weapon available to you to defend yourself from an attacker, you use your voice. That's what's taught in sexual violence classes. Use your voice. I did, and I got evicted as a result of it. I'm homeless on the street as a result of that. On the card that I received, Officer Vieira wrote disturbance. That is not an accurate assessment of what happened. And he said that his logic was, it's his word against mine. So really, that person could have actually committed a sexual battery and still not been held to account. And from that day to this day, I have received no counseling from the YWCA and absolutely no housing, nothing, absolutely nothing. And I believe that's because I'm a man, that I didn't receive anything, because a man can't be sexually assaulted, especially one my height and my build. The officers told me that somehow or another I was responsible for my reaction to being sexually assaulted. And as a result, I'm being evicted, and they were fine with it. I received no information, no nothing. So while you have your experience, the actual lived experience in the community is very, very different. Now, there was a captain that called me, and I spoke with him at length for about an hour before this phone call, because he was really interested in hearing what had happened. You know, and
we'll have to cut you there short,
right.
Paul.
Yeah. Thank you.
Thank you. Okay, and next up we have Catherine Campbell.
There we go. Am I unmuted now?
Yes, you are.
Okay, great. Thank you. Thank you so much for this presentation today. I've been on the task force to end child sexual abuse in our county, and we were working for, I think, 3 years and before the pandemic. And then we really identified where our gaps were, and where we saw a gap is when children report sexual abuse in a family, it goes instead to family court because there's not enough to prosecute. And at that point, we're having children lose custody to the abuser at the rate of like probably 85%. And it's about 98% if different terms are used nationwide. So this is a trend that we're not capturing that. And as your data showed, over 50% of the people that were known, which is more than 50%, over 50% were family members. And you see that the rates are going down for children this year for those reports, but the sexual abuse material online is going up. And we have to realize that that is being produced in the homes as well. It's not just someone getting on a computer. And I don't know if you have the numbers for that. But I do know that we need to really bring in more to our court system to protect these children. And I know there's a gap there. We've identified it, and we need to work more to be able to name abuse against a parent, because that has not really happened in our county. I think only we're at 10% about for identifying. And I just didn't know, when you were talking about survivors in this report, are those reporters or survivors? Because the survivors are only noted at 10% of those who report. Thank you.
Okay, thank you. Next up, we have Blair Beekman.
Hi, thank you. It's nice to hear Paul Soto's voice. You know, it's nice that you know, in a way, how you know, these public meetings can really offer a place of steadiness for ourselves and for issues. And thank you that you provided that for myself to a certain degree. You know, that's giving me a certain. I guess we're all survivors in a way, and your public meetings each week is a way to just keep me going and help me survive, basically. And I'm trying to become a better person out of that. So thank you. You know, for this item, it was really nice to hear a lot of references to SEIU work, I think is what I was hearing correctly. And boy, you know, that's saying a lot. And I think it's indicative of, you know, the hopeful changes that we're making, you know, to give people the options of how can they call, how can they get help in the future. The city of Oakland, they just passed a series of beginning stages of their Reimagine work. You know, it's a huge community effort involving all parts of the community. And it'll be really interesting. Fremont is doing some of the same things. And, you know, how can everyday community be involved with it when people need help and have questions? And so good luck in how we will be working on those ideas too, and making it just safer and easier for people to call. And you know, good luck with the SJPD peer review program and how that can become a more open process for all parts of the community, and how that can develop good mental health practices for all of us. Thank you.
Thank you, Blair. And okay, I thought we had another hand up on the attendee side, but I don't see anybody. Oh, there we go. There's a caller with the number ending in 4054. And if you're calling in with the number ending in 4054, you will have to press *6 to unmute yourself. There we go. You are unmuted.
Thank you. Hello, my name is Rose Klein, and I'm with Aki Asian Women's Home. And I was calling as a service provider for survivors of violence, abuse, and trauma. And we often see the communication gap between law enforcement and our communities, especially communities of color, immigrants, and limited English-speaking families. The system's response to gender-based violence has become even more critical during COVID, when survivors are trapped in their home with the person who is harming them. At Aki, requests for hotel and restraining orders have doubled since COVID started, and more survivors than ever are seeking our hotline for support for their mental health and housing needs. Our diverse communities face too many barriers to seeking help. Studies show that as many as 55% of API women report experiencing intimate violence in the U.S., but only 5% of local domestic violence felonies involve Asians. Our criminal justice system sees the 5%, and our victim service agencies see the other 50%. To see the full picture of family violence in our city, we need more proposals like the one offered today, providing a path forward together through a data-driven, coordinated community response, including culturally responsive community advocates and emphasizing long-term policy change for underrepresented survivors and their families. Thank you.
Okay, thank you. Now we will come back to my colleagues. And first up, we have Councilmember Arenas.
Thank you, Chair, and thank you, Angelique and Lieutenant Jimenez, and all of you who've been working on this matter for some time now. I think there's somebody here from the YWCA. Cynthia, yeah, I'm so sorry. I want to make sure I recognize it. And, you know, I appreciate the, Chief Tyndall, you giving this the attention that it really deserves. We spoke about this at length, and previous to you, I know that we were working really closely with Lieutenant Anderson as well, and Captain Taw. And so there's been so many really great police officers, detectives, and just commanding staff that have been really supportive in making sure that that we have some systemic changes in the way that sexual assault crimes are handled, and with always with the victim in mind, and in the long run, trying to have a better closure rate, because when you have a better closure rate, you also have better closure for that victim. So one of the things that I just want to commend you on right off the bat here is your SOPs, the standard operating procedures that you've integrated. I really appreciate that. They were very thoughtful, very much needed. And Lieutenant Jimenez went through most of these. And so I did a session with him. So I'll just advise my colleagues that I asked a lot of questions ahead of time, but I know I'm going to take you just through some of the questions that I had, and so that our community can also understand where I was coming with, the kind of concerns that I had in the moment when I was reviewing this. One of the things that that struck me was and that I wanted to mention was the number of exams. I know this was an audit, not from our recent one, but from last year on the rape kits. And we don't count really the number of exams that were approved. And I know that there's some issues that are now being handled and now being addressed with those kits. Can we continue to count the number of exams that are approved so that we could see when these reports come in, we see the total number of survivors, and then we can see the exams, the forensic exams that go along with those.
So I think I'll take that question. Thank you, Councilmember Rennes. That is something that we can track internally about examinations. I think we're referring to SART examinations, both pediatric and adult SART exams. So like I said, I'll work with Angeli as well, but that's something that's not easily extractable from our Versadex system, but that we can put on a spreadsheet. We'll work with that spreadsheet and see how it works out over the next few months, and we'll report back.
Perfect. I really appreciate that. One of the changes that I'm going to just review really quickly of the standard operating procedures is when a child is sexually abused, sometimes it may not warrant an exam. I think this was a bit more subjective in terms of having a criteria of whether that sexual abuse was involved penetration. And so I know that there was a lot of care in that decision because you don't want to re-traumatize somebody, especially a child. But I know that you're moving closer to allowing more of these exams happen that didn't have penetration, and so that that if there is any skin to skin sexual abuse, that those referrals will move forward to a sexually SART exam. So my question is, what is the best practice standard there? Is that typically where we draw the line in the sand and say, you know, when there is skin to skin, that's when we move forward? I don't know what the experts say here, so I'm going to rely on you.
Right. So myself and Brian Anderson, we've had conversations with Mary Ritter and the district attorney. We've also had conversations with DFCS. We've had other conversations with other stakeholders to try to figure out what's the best way to address, and we're referring specifically to pediatric SART examinations, correct? And that's typically children from the ages of newborn to 11 years of age. So it's very difficult to determine when it's best, but we do authorize SART examinations on skin-to-skin contact, penetration when the child's very young and we can't get a very good disclosure, right? Sometimes there's trauma present, but we don't know why it's there, and it may be that the child fell off a bicycle, but we authorize those examinations to ensure that it's the right thing. When we don't authorize them, we start getting into where the kids are older and they provide disclosures that are more precise. So if we don't have certain, contact, whether it's skin to skin or penetration or something more obtrusive, we basically would defer to decision making with the MDI team, which is the team that's comprised of the district attorney's office, DFCS, and the police agency. They collaborate with one another and they make a decision after interviewing the child to determine whether or not pediatric SART examination is the next step in the process. And we memorialize that as well, so that we're being very clear as to when we do and don't authorize those. But we all obviously err on the side of caution, and we want to make sure that if we're erring on the side of providing the examination rather than not providing it.
I really appreciate that, and I know that I hope that we can commit also to being very proactive to tell our survivors that even though they, especially those who have had a rape kit or maybe a SART exam, but definitely the rape kit and those that are of age can speak for themselves, that if they're not ready, or their family members, if they're not ready, that you can shelf this. You can get the results, you can forward it to the county, get that evidence examined, but you may not be ready to do something. I know that you also have a slight change in that as well, in that if you have a known suspect, then you will forward that to the DA, which is something that wasn't happening before, correct?
I think with the separation between SAU and SVU, allowing more oversight and less span of control, it allowed for us to figure out what was happening. And it wasn't that it wasn't happening before, it just wasn't consistent. So we moved from an area where we created standing operating procedures to be more consistent in our delivery model. So now when we have cases where there is an identified suspect, the police are just part of the criminal justice system, and the district attorney is the one who decides who to prosecute and not to prosecute. So we forward those cases to the district attorney's office for that reason, and also for other reasons, like we're in a county and San Jose Police is one agency amongst many, and that same suspect may be identified in a separate case from another agency. So we think that it's a good idea to forward that information to the district attorney's office so that they can link known suspects in maybe other cases. And ultimately, the decision to file or not file is a decision that's made by the district attorney's office.
Right. Thank you, Lieutenant. That's one of the points that I really wanted to share with the community, because I think it'll allow for some of that linkage that you're talking about. and not let these folks just, stand in the wind here. I have a question on page 9 of the report. You have a count of victim relationship to offender. And this is something I already asked you about, Lieutenant Jimenez, but because I heard the speaker earlier, I want to ask about this once again and just confirm. So on this table, it has relationship to offender, and then below it has a code OF, victim was other family member, which is 149. I think we saw that in the slides when Angelique was reporting. And then CH, victim was child, 146. And I wanted to clear up, since Angelique is here, what does that mean?
So thank you for the question, Councilmember Arenas. So to clarify what that means, that OF victim was other family member, is just, it wasn't clarified in the report in terms of what exactly the family member. It's not in our categorizations in Versidex. We have child, we have child of parent, stepchild, spouse, grandchild, siblings, and other terminology such as boyfriend, friend, those that are non-relation, familial in terms. So there's really no other categorization outside of like the stepchild, the uncle, the spousal, familial relationship. So it's all kind of housed under victim was other family member if it's not under that Versidex category. Then
no, that one I'm clear, Angelique. The one that I was referencing was victim was child.
Oh, okay.
Does that mean that they were, they themselves were underage?
They were underage and they were a child of the offender. So it's a victim,
it was a parent-child relationship.
Yeah, parent-child relationship. So victim relationship to the offender, meaning that the victim was a child to the offender.
So then what is victim was parent?
So in terms of victim was parent, at the very bottom, victim was parent. So I think in terms of that particular case, it could have just been a miscount in terms of the victim was a parent to the child in terms of, I'm not sure, I'd have to relook at that case. I can't remember at the top of my head, but a lot of these Versidex, also keep in mind that some of these Versidex codes are also older, and that's why they're disseminating in numbers as we better our reporting methods. So victim was parent could just be an anomaly that was miscounted. I'd have to look at it.
Mm-hmm. So thank you, Angelique. I thought, and it's very sad to acknowledge that victim was child means that was a parent-child relationship. And I'm going to go back to what the speaker, Catherine had said, and I think she also participates in the South Bay Human Trafficking Task Force, that most of these reports are going to family court, and some of those parents are being awarded custody. And I wasn't sure, and if any one of you could clarify whether that is something that we can, are we categorizing the crime in such a way that it drives it to family court?
So I'll jump in there, and Lieutenant Anderson, if you would like to join me as well. The police department memorializes cases, conducts investigations, submits to the district attorney's office, and how it navigates the system is not necessarily something that we control or have any way of tracking. That is something that I'll bring up with the district attorney's office as an issue and see what the response is. But I don't know if we can track that with our internal system. The answer would be from what I know is we can't, and I don't know how it gets over to that court versus other courts. That's more of something that happens at the district attorney's office level.
Yes, and Lieutenant, and whoever goes and whoever attends with the rest of the committee members at the joint meeting with the county, this might be a question we could bring up, because if it is how, I don't know the code that we're using to categorize the crime. I mean, I don't know. Only you all know this at this level. And so if there's something that we can change to improve outcomes, then I'm hoping that we can consider that. If not, then this might be something that the county and the DA obviously have to deal with, and an issue that we might want to raise with them. So the last thing I'm going to say, and I know I'm keeping this short, right? Is just some feedback from one of our stakeholders, and I apologize. I'm going to read it because it was just sent in from my team, and I have not read it, but they marked it so we can memorialize it here. Okay, so there is one immediate concern that SIU is treating 12 to 17 patients as pediatric cases and will be provided only 72 hours to obtain an exam. This is below the standard of care. 12 to 17-year-old survivors of sexual assault are able to have a medical forensic exam within 10 days from assault as outlined in the sexual assault protocol. All survivors of strangulation are able to see a minimum of to be seen a minimum of 10 days after assault, but we have seen them up to 5 weeks after assault on a case-by-case basis. And so I think one of the items that we talked about, Lieutenant Jimenez, was that you weren't going to put a timeline on those exams. Can you talk a little bit more about that?
Right. So 72 hours is something that's commonplace. It's a best practice. That's when you can get the best evidence for DNA purposes or other types of evidence. Right. However, we've gone away from that in the pediatric SART examinations. The standard's gone away from that in regular adult examinations. SART examinations are typically authorized beyond that. So the standard that's not what our SOP reads. It's not a 72-hour standard. We've gone away from that. We've authorized SART examinations that occurred a year prior, depending on the age of the victim or survivor. It's a lot of the reasons why the child side of it, the 0 to 11s or 12, 17s are not getting pediatric SART examinations or adult examinations at that age because they would get it, is because of the delay in reporting, where something occurred 5 or 6 years ago and a pediatric SART wouldn't necessarily uncover any evidence related to the sexual assault. But to clear up that question is we're not relying upon the 72-hour standard anymore. We go much further than that. It's very complicated on how and when we do that, but typically you can see SART examinations being authorized that occurred 4 months, 5 months, 1 year prior to, depending on the age of the survivor.
Thank you. I'm going to move into just the trends. I know the trends continue to be Latina children, and next is Caucasian, and we heard Angelique go really into depth in terms of the category, so I won't go over that. But I wonder what is. And we can talk offline about this, but I wonder what it is that we can continue to do to help prevent some of these crimes within that population. I saw that 95122 once again has the highest number of sexual assaults. And we know that it has the same number of people in that zip code that live in the city of Gilroy. So a definite an overcrowding. And so I was wondering if maybe when we get to the Child Advocacy Center, which is what you're going to be co-located at, I believe, Lieutenant Jimenez, is that we prioritize some of these sexual assault victims so that they can receive some housing support. Because one of the reasons why, Angelique, I was really hoping to figure out why, where are they living under the same roof? They might not be related, might be somebody that they know, but they're not related, yet they're living in the same roof, because 2 to 3 families live in one home or apartment because of the high cost of living. So that's one of the reasons why I was continuing to pursue that. And Angelique, I'd love to talk with you later on and see if maybe we can really narrow that piece down, and then maybe connected well, we'll talk offline because I think there's some potential there. The county is interested also in joining us in this study, in this efforts of the study. Thank you so much for including the ICAC information. And just one question I had, I saw how in April, the number of cyber tips increased. And so I wanted to ask you on page 22 of the report, there's a reactive and proactive number count. What is exactly reactive and proactive? Proactive, I'm assuming you're setting up, I don't know, a sting, online sting, something of that sort.
Proactive
to be a 12-year-old.
Proactive can be a case where we take over a victim's account because the victim has come forward, and therefore we act, detectives act as a 12-year-old. It also can be the fact that we monitor something. It would take several hours to explain the whole details of it. But there's certain download sites that we monitor to make it very basic in description, where that it would consider as a proactive case. And then there's also what we call traveler cases, where our detectives are acting in a UC capacity as an underage minor.
Mm-hmm. Thank you. So one of the, and I had a little more questions on that, but I'm going to take it offline because I know we have a lot more to talk about. But one of the things that we have in the money that we secured for sexual assault victims, survivors, is education. And I wonder if maybe we could, and then a kind of a campaign, if you will, of education. And I wonder if there's something that we can also help out with in respects to helping, having people be more aware, especially parents. I appreciate that parent piece that you included in there, but I wonder if there's more campaigns, online campaigns to help us deter some of these folks, or at least report them. But I'll take that conversation offline. So in the end, I'm just absolutely pleased with this report. I know these kinds of crimes, I'm never going to be satisfied until there's 0 on these pages. Ultimately, that's what I would like to see. But seeing that there's a lot of these duty manual changes and SOPs that have been that are shifting, I'm really hopeful that we'll have some better closure rates, and so in 1 year I hope to be talking to you about lower closure rates. But when Lieutenant Jimenez sat down with me and talked to me about some of the standard operating procedures, I really almost cried at the end. I didn't let him see it, but it was really touching because it means that I don't have to move this issue, or any of my other colleagues have to move this issue, that these procedures will ensure outcomes for our future survivors. And so that for me is really where change comes. And so thank you so much. And lastly, I just wanted to thank Jennifer McGuire, who I know you're always supporting us in this around this issue. So thank you so much. And I move to approve.
Second.
Thank you. We have a motion and a second. I don't see any other of my colleagues with their hands up. So I would just have a couple questions. And thank you for the thorough presentation on this. In the report, you mentioned the expectation of an uptick in reporting, obviously due to this past year that we've had. And I'm curious how we are preparing for that uptick, or if we are.
Yeah, so our assumption is that it's going to occur because sexual assault, unfortunately, we get a lot of delayed reporting. So that's a natural phenomenon in what we do. And if the theory is true that people are housed with the perpetrator, potentially they can't report. So as the schools open and as people have access to mandatory reporting personnel, whether it's police officers, medical personnel, nurses, people like that, the YWCA, they will report hopefully if a crime did occur, and that we'll get that. And our preparation has been is a lot of internal in-house cleanup. We've gotten caseloads really down during COVID. We've reprioritized how we've conducted investigations. We do them more timely, and on average, historically, cases were 5 to 6 cases higher. Now we have detectives who have cases that are in more of the 10 to 12 range and even lower. The department standard now for SAU is 17 cases or less, because once you get above too many cases, it's very difficult to do cases in the manner in which we expect them to be conducted. So I think the preparation has been in the sense that we've pushed a lot of cases across the finish line, so to speak, to get them completed in a thorough fashion and submitted to the district attorney's office appropriate, so that if we do see an uptick, essentially detective caseload is lower, and that would prepare us for an uptick if we will see it, and only time will tell, I guess.
Okay. Yeah, I don't know what to say on that. You know, sort of, we obviously hope we don't see an uptick, but at the same time, we also know that that could just indicate that people are not reporting, which is not necessarily a good sign. Another potential avenue where a lot of reports have come in have been through schools. And as we get students actually back into school in person, especially next year, I think we have to expect potentially an uptick, especially again if some of these survivors are still living with the perpetrator. Schools have been an outlet or an avenue of a safe place for reporting. I'm curious how we may be preparing for that. Number one, a number of school districts as of last year have decided to cut ties with school resource officers. I know I served as a school resource officer for 6 years, and I know that it was sadly, but it was frequent where we would be approached for reports of sexual assault. And now that potentially there won't be as many school resource officers on campus, I'm curious how we are preparing to help out the schools, right? So that they're prepared and we're ready to help them out as students are coming back into in-person classes.
Right. That's why one of our recommendations going forward, or one of the things that we're going to focus on, is working more closely with the crime prevention unit. They obviously have a lot of allies within the school programs throughout the city. And obviously the reason why we invited the YWCA here is they have very robust programs in education and support of individuals, and that can also translate into schools. And I don't know if this is a good time to just thank YWCA for being here to begin with, and just being a partner and always supporting us here at the department and supporting our survivors. So I don't know if this is a good time, Lindsay, if you'd like to maybe say a few words, if it's appropriate.
Please do.
Okay, please don't mind the background noise. I have a semi-full house right now. So in regards to your question, Ro, we do have services that we're still providing virtually, right? So we have T-Club. I think in the last fiscal year, we had 269 students that took part in the T-Club. They're learning about consent, they're learning about healthy relationships, teen dating violence, and sexual assault prevention. And you know, while we're doing that education component, I think a lot of what that does is also open the door for students to be able to reach out to the person that's, you know, overseeing that program and say, hey, I have this situation going on. And then that brings them kind of back into services. So that's one thing we've been working on as an agency, is really linking up all of our programming so that referrals are pretty seamless, and making sure that we're utilizing all the organizations that provide support. So Community Solutions, Aki, Maitri, Next Door. And we are in quite a few schools. I don't know if you want me to list them out, but I think we're in over 10 different schools providing this.
maybe instead of listing them out, because I know we didn't get, to all schools, whether it was before 2020, right, with in person or virtually last year. Do we have plans to try to get out to some of those schools that maybe we haven't been able to connect with?
Yeah, so the education component is not within my programming, so I don't want to misspeak or give you any false information, but I can definitely say that we're always looking at more people that we can reach, because we do know how valuable this component is for education.
Okay, great. Yeah, thank you. And thank you, Lieutenant. Okay, another question that I have is in regards to the DOJ grant that I understand will expire later this year in September. And that's what's really allowed us to house the full-time YWCA advocate. And I know that we are in the process of applying for that grant. Again, is there any, I guess, idea that we can be given some assurity that, we are a good qualifier for that grant? Or more importantly, is there anything we can do from this committee to help support that effort?
So I'll start off. Lieutenant Anderson and I, along with Lieutenant Lang, met with Fiscal. We've discussed how to approach it. We've updated the application. We spoke with the YWCA as well, with Lindsay Mansfield and Amy McLean, who provided some information. We think that we've had success stories over the last 3 years that would help us be very viable for receiving the grant again in the future. We've memorialized that, and we're hoping that it would get awarded. However, we can't ever guarantee anything until it actually happens, but we've been meeting the deadlines, and we've been memorializing the document to read in a way that I feel is a strong, applicant. I don't know if Lieutenant Anderson or Lindsay, if you have anything.
I believe that we're a strong candidate for it based on the SOPs that Lieutenant Jimenez has been able to put forward. And then also the intersectionality forum that we've been able to create with Community Solutions. So obviously, once again, there's no guarantees, but I do believe we're working with our grant people in Fiscal, and I believe we have a strong application this time around.
Yeah, I would just echo that we really came together and tried to come up with a good plan to strengthen our application. What we're already doing is working. We've really gotten a lot of traction over the last year or so. And we're looking at ways that we can also do some of those education and outreach events. I think, Sylvia, you were part of one of those that we did with the Family Violence Unit. And I think that lends itself to strengthening the application as well, because it brings in the awareness to the communities so that they can come back into services.
That's great. Yeah, that's obviously, we appreciate getting grants for this kind of program, and that helps us offset costs that we might want to prioritize ourselves. And so it's good news to hear that. And then lastly, for me, just want to say thank you to the sexual assault unit in regards to your quick response on the increase that we saw on those online tips, and really just all your efforts throughout this past year and for this thorough report. And I'll pass it back to Councilor Moreno.
Thank you, Chair. Actually, I was going to bring up that DOJ grant as well. Since our assistant city manager is here, what better time to advocate for some of the things that I think we should just be part of our budget without even having to ask. And that is additional analysts. One, the DOJ, but Councilman Pearl's already covered that. And then the second is something that Angelique and others, Lieutenant Jimenez, obviously many others have identified, and that is potentially an additional analyst, because I think they share that with the various units, and there's only one. Angelique is it. So thank you, Angelique, for all your hard work. And then the last thing is to make sure that we match our efforts with the areas that Angelique has really honed into by zip code. Obviously, we're not going to catch anybody in the crime, but we know where these folks live, and so I think that we need to be proactive. And it's the zip codes that you typically expect, but I think that we need to be very intentional with our efforts. So when there's support services that or additional services that we target that community, and one is of course always through education, because we can increase the number of reports, and especially I heard that loud and clear, Angelique. I think I'm always adding I'm trying to add a Q at the end, Angelique. It's Angelique, I know. Okay. Is to increase that reporting for our API community, which I'm also very concerned about. So we need to make sure that we provide that education and it matches some of the zip codes. So anyways, that was the last thing. And if it is, oh yes, you are here. Chief Tyndall, thank you so much for agreeing to make the Sexual Assault Bill of Rights a part of this work. And thank you, Councilmember Perales, for your advocacy and ensuring that it didn't stay on priority list somewhere stored away, but that it's actually going to materialize really soon. And I'm really excited. Lieutenant Jimenez gave me an update, and it sounds like we're moving in the right direction. So that was it. I promise.
Thank you, and you're welcome. Okay, I think we have a motion in a second. If we can get a roll call vote, please.
Jimenez? Jimenez? Mahan?
Aye.
Jones?
Aye.
Arenas?
Yes. Yes.
Perales?
Aye.
Thank you.
And yes for Jimenez. I apologize.
Okay, thank you.
All right, thank you very much. That motion passes unanimously. Now takes us down to item D2, which is a presentation from our police department on duty manual updates. Chief, I'll hand it over to you again.
And again, I will pass that off to Lieutenant Donahue.
Thank you.
I think I actually will be presenting on that correction. So I have the slides up here, unless Lieutenant Donahue, you wanted to start off. I'm not sure.
Nope. Go right ahead, Angeli. Thank you.
I'm sorry, Angeli. I should just be handing it directly over to you.
No worries. I just wait for my cue. Thank you.
It's like a hot potato we're passing around here.
Absolutely. So as directed by the City Council with its approval of a memorandum from Councilmember Arenas on August 18th, 2020, this item updates the committee on duty manual updates. The duty manual amendments were meant to achieve the following two objectives. One was requiring officers to respond to and investigate all calls for service for domestic violence, child abuse, sexual assault, and human trafficking for potential high lethality and write police report if a crime occurred. And two, ensuring a trauma-informed approach to an officer's response by providing survivors with access to an in-person advocate and/or a referral to such advocate by telephone, pamphlet, or resource card before the officer leaves the scene, regardless if the survivor asks for the referral services. This report also includes updates towards the end of the presentation on related duty manual changes that don't fall under one of the above two categories. To address objective number one, requiring officers to respond to and investigate all calls for service for domestic violence, child abuse, sexual assault, and human trafficking for high potential lethality, and write a police report if a crime occurred, 6 sections with regards to domestic violence, physical child abuse, endangerment or neglect, investigations of sex crimes, and sexual assault cases of the duty manual were amended to require officers to respond, investigate, and document all calls for service, to interview survivors in a private setting and require investigation, and to specify using a multidisciplinary interview for juvenile survivors, interview in private settings, and require investigation in accordance with Section L6000. Please note that Section L7307, domestic violence reporting, already was contained a requirement for officers to respond to, investigate, and document all calls for services involving domestic violence. We just added it here to display the responsiveness of sections of the duty manual. Section L6018, human trafficking, was added to the duty manual to require officers to respond, investigate, and document calls for service. With regards to objective number 2, ensuring a trauma-informed approach to an officer's response by providing survivors with access to an in-person advocate and/or referral to such advocate by telephone, pamphlet, or resource card before the officer leaves the scene, regardless if the survivor asks for the referral service. The following sections with regards to domestic violence, physical child abuse, endangerment or neglect, investigations of sex crimes, and human trafficking, language was added to the relevant section, reminding officers of their individual responsibility to assist survivors through a trauma-informed approach, offer and explain resources to the survivor, conduct appropriate investigative tasks, make arrests when allowed by law, and properly document the incident when suspected domestic violence, child abuse, sexual assault, or human trafficking is discovered or otherwise reported. Sections with regards to notifications to survivors of sexual assault. Both sections explicitly discuss providing survivors with access to an in-person advocate and/or referral to such advocate by telephone, pamphlet, or resource card before the officer leaves the scene, regardless if the survivor asks for the referral service. Alongside with objective number 2, sections L6009, notification to survivor, and L6010, notification to survivor advocate, discuss providing survivors with access to an in-person advocate and/or referral to such advocate by telephone, pamphlet, or resource card before the officer leaves the scene, regardless if the survivor asks for the referral service. And section L6017, advocacy referrals, was added to create a requirement for department members to provide advocacy referrals to survivors of sexual assault and domestic violence before leaving the scene. And sections R1526, domestic violence resource card, and R1527, sexual assault report receipt, were modified to require officers to not only provide the cards to the survivor, but explain them as well. Section R1526.5, strangulation resource card, was added to require officers to provide resources to survivors of strangulation and/or suffocation. Other related duty manual updates include Section A3003, duties of the CSO, and A3007, dispatchable calls for CSOs, that are being modified to expedite documentation of non-investigative sexual assault reports. Section L4113, gun violence restraining orders, and L5704, booking firearms for safekeeping domestic violence incidents, are being added to create a requirement for officers to inquire if any firearms are accessible and/or on the premises of a domestic violence incident. If there are, officers are directed to take custody of those firearms pursuant to a gun violence restraining order and book them for safekeeping. Section L6002.5, non-investigative report, is being created to establish a new means by which survivors may report a sexual assault while remaining anonymous. Section L7307, domestic violence reporting, were modified to implement a new intersectionality tool. Sections R1536, DV supplemental template, and DV sexual assault human trafficking assessment template, and R1536.5, domestic violence field reporting guide and sexual assault human trafficking assessment, have been modified to update domestic violence forms for the use of the intersectionality tool. And I'll leave it up to the lieutenants, Lieutenant Jaime Jimenez, Lieutenant Brian Anderson, for any questions from the council. Thank you.
All right, thank you very much. And we will now go over to our members of the public. And first up, we have Paul Soto.
Yes, thank you, Councilman. My response is directed at Dave Tyndall because his Chief Dave Tyndall, because his name is on this memo. It says here a trauma-informed approach recognizes the impact of the event on the survivor, not only physically but also emotionally, socially, and psychologically. This type of response promotes an environment of healing and recovery. I received absolutely none of that. In fact, Officer Vieira really tried to convince me that I misunderstood what happened. You see, if I'm a woman, it's you believe every single thing that comes from her, and that is just. I agree with that. But when a man reports this in a very vulnerable time, and my response to the sexual assault is to be evicted, what he did is on my card, which I still have, he reported it as a disturbance. You see, at the point of contact, when the officer mischaracterizes it, it doesn't trigger these protocols. You see, so he's not going to be held to account for these protocols if he writes down a disturbance. That is an enormous amount of power for an officer to exercise within the context of somebody that has experienced such a emotional response to what happened to him that he's being evicted for it. You see, this is something that and you're getting grants. The YWCA is getting grants for this. The system failed in my case. I contacted the YWCA. I was crying on the phone, literally weeping, asking them, I need some counseling. I need to process what just happened to me. They never got back to me. Not one person got back to me. That was on March 3rd. That's why I had that conversation with the captain earlier today. Thank you.
Okay, thank you. And Paul, just want to make sure you know that you are being heard, and I'm glad you were able to have a conversation earlier today. And we will ensure that you get some follow-up on that at least to be able to ensure that everything is reported correctly. And there are other avenues as well that could be pursued if you still feel that has not been the case. But our city manager's office as well has stepped in to just ensure, right, that you are being heard here and want to make sure that you receive the appropriate services and response. So thank you for that. And then next up, we have Blair Beekman.
Hi, thank you. Blair Beekman here. I wanted to clarify my words from the previous item that, while, the work of the SEIU and learning that there can be non-police ways to ask for help, I don't want to totally, with these sort of issues, exclude that some people actually may prefer and need the police to be called. I was just trying to offer the options for people who actually do fear calling the police. But, both options should be viable in the future, and that is part of our reimagined future. I hope it can be, non-competitive, and how we build that future, it can work well on both ways, and it's for the person to decide what's best for them, basically. And what Paul Soto just mentioned, I'm really curious that, if we better develop the peer review program in San Jose, I mean, does that mean that would the officer who handled Paul's case, would he be talking it over in a formal setting with fellow officers and getting a handle and understanding of exactly what his situation was and how, it could be improved? I mean, to create a space to do that, so they can double check with themselves. I think that's the goal of peer review. I think you're using it within sexual assaults and things. I don't know if it's a program that needs to be considered expanded within SJPD or not. I don't quite know the depth of it, but at least that's the intention of the peer review program. And so they can review, Paul's case that, they handled it one way where it really could have been handled a bit more openly, and how to talk about that afterwards more openly between officers should be important. Thank you.
Thank you, Blair. Next up, we have Perla Flores.
Good afternoon. I just want to take this opportunity to thank Councilmember Arenas for your continued support and uplifting survivors' voices, ensuring that the response is trauma-informed and that there is quick access to a confidential advocate. We know that when survivors are promptly linked to a confidential advocate, their immediate basic and safety needs will most likely be taken care of, and also there's a greater chance that they will engage in services over the long term. I also want to thank the San Jose Police Department for your commitment to addressing gender-based violence in an intersectional and collaborative manner, and really look forward to continuing our work ensuring that survivors are not siloed and that we're addressing all the different victimizations that survivors endure. Thank you.
Okay, thank you. And that concludes our public comment. I'll go over to Councilmember Arenas.
Thank you, Chair. I want to thank once again, Angeli. We're always going to begin with you. And everybody who's worked on this report. Lieutenant Donahue, really appreciate it. And what I'm going to move this memo. I don't have much more to say. I'm very pleased about the changes. One of the things that I just wanted to mention, and this is something I've already spoke to you about, Lieutenant Jimenez, is that while I really appreciate the intersectionality tool being used and domestic calls that involve intimate partner violence, I think we should also use this intersectionality tool during sexual assault calls to inquire about intimate partner violence. So, just vice versa. And I know, Lieutenant, you say you would be open to taking this back and exploring this, and so I hope that that we can move in this direction, because I think obviously that's why we have an intersectionality tool, because we know all of these things connect, and then eventually I'd like to see that in our human trafficking incidents, because I know that there's an intersection there, and I talked about that pipeline that leads to all of this. So I don't know if anybody wanted to just respond to that.
I'll talk about it briefly. Maybe Lieutenant Anderson can respond as well. So yeah, we hear what you're saying is that we use it in DV cases to get sexual assault cases reported. And what you're suggesting is that we should look at a similar tool when sexual assaults occur to see if we get domestic violence reporting to happen. So we will definitely bring that up with Lieutenant Lang as well, so we can talk about it also with our partners to see if that is something that we can explore in the future. I don't know if you have anything to add to that, Lieutenant Anderson.
No, I do believe it's something that we should take a serious look at. We are going to be rolling out here in the next few months recognition for human trafficking, which would then roll right into a lot of those questions that are already on that intersectionality form. So the more we can get those questions out there to bring to the surface whether someone is being sexually assaulted or trafficked, the better.
Perfect. Thank you. And once again, I really look forward to sharing some of this information with our counterparts at the county during our joint meeting, and it'll happen in April. All of you will receive an invitation very soon. So that is it, Chair. Lastly, I just wanted to honor Paul Soto and his comments. Paul Soto and I did speak, and I won't, of course, reveal anything that he hasn't already said, but we did reach out to YWCA that very day and to other service providers to support Paul. And I believe the YWCA, like many other agencies that where I'm encountering, is that they just have a huge waiting list. There's many of us who are working from home who are just, probably creating a backlog for service for many of these service agencies. And so I hope that, Paul, we can talk offline. Thank you Councilman Perales for ensuring that he's going to get that contact or that follow-up. Also, I also spoke to Captain Trayer about his case. And so Captain Trayer was the one who probably called him earlier. I don't think it was Chief Tyndall. And so anyways, I just wanted to clarify that we are just as concerned for him as a survivor of sexual assault as we would anybody else. And so I don't want it to appear to our community that we haven't connected and that we haven't responded in the same way. Absolutely, it doesn't matter what the gender is. My response would still be the same, and that is to make sure that he has the support that he needs. Unfortunately, like I said, there is a wait list, but we can, and I just heard from my team that we will continue to reach out to Paul and connect with him. So I just wanted to, I don't want to leave that out there just for folks to think that we are not responsive to men as equally as we are to women. So, and move to approve.
Second.
Okay, and in the motion, if you can just include that this will be referred to, refer the duty minute updates to the April 13th council meeting for full adoption.
So moved.
Thank you.
So moved. And thank you, Lieutenant Anderson.
And that's fine with the seconder as well?
Yes.
Yes. Well, whichever one of us it is. Yes.
Yes.
I'm going to give it to Vice Mayor Johnson. Okay, if we can get a roll call vote, please.
Jimenez,
Yes.
Mahan,
Aye.
Jones,
Aye.
Arenas,
Yes.
Perales.
Aye.
Thank you.
All right, thank you. Motion passes unanimously. That moves us on to item D3, advocate referrals. Further improvements to processes and data sharing can help connect more survivors to services. And I believe I'll hand this one over to start to our city auditor, Joe Royce.
So good afternoon, Joe Royce, City Auditor. We do have a presentation, and Allie can bring that up. I'm here with Allison Pauley, Abella Obi, and Juan Barragan from my office. We're here to present our audit, advocate referrals, further improvements to processes and data sharing can help connect more survivors to services. So the objective of this audit was to assess protocols for and timeliness of community advocate referrals for survivors of sexual assault, domestic violence, child sexual abuse, and human trafficking. So in the state of California, survivors of certain crimes have a right to have an advocate present with them during interviews with law enforcement or defense attorneys. These advocates can provide a broad range of services to a survivor, such as explaining information about the criminal justice system, communicating with prosecution or law enforcement, helping them find safe housing or transportation, and connecting them to further resources or support from other agencies. Law enforcement plays a role in notifying survivors about their rights and referring them to advocate services. In the San Jose Police Department, patrol officers provide resource cards to survivors and may connect them with a crisis hotline or ask if they want to be contacted by an advocate. Later, detectives may also provide resources about advocates to a survivor. The department works with the YWCA Silicon Valley to provide advocacy services for survivors of domestic violence and sexual assault. And community solutions for children, families, and individuals. They provide advocacy services for survivors of human trafficking. Santa Clara County's Department of Family and Children's Services takes the lead on working with families for child abuse cases. We had 3 findings in our report. In the first, we found that updates to internal processes would help connect survivors to advocates. Police Department provides information about advocacy services throughout an investigation, which allows for multiple opportunities for officers or detectives to connect survivors to advocates. In our report, we include various process flows demonstrating how a survivor may be connected with an advocate. So the information in this slide is difficult to read, it's pretty small. We want to show the redundancy in the process. As a response to an incident and the related investigation unfolds, the green boxes indicate different steps in the process where some form of an advocate referral or connection to services may be occurring, including when a survivor is given information about advocates. As I noted, There are redundancies in the process to ensure there are multiple opportunities to connect survivors with advocates. However, we found that the duty manual does not explicitly include guidance to offer advocacy services before any interview. Doing so would align better with Santa Clara County protocols and other jurisdictions that we surveyed. In addition, resource cards reference the right to an advocate, but would be more helpful with further information and be fully available in Spanish and Vietnamese. Finally, standardizing the process for how detectives refer victims of sexual assault to advocates could help advocates reach more survivors. So to help connect more survivors with advocates, we recommended that the department update internal processes to match county guidance and standardize referrals, and revise and fully translate resource cards into Spanish and Vietnamese. In our second finding, we found that the police department provides additional resources for survivors of high-risk domestic violence cases. So to identify and respond to high-risk domestic violence cases, the department uses a lethality assessment in a high-risk response team. For cases assessed as high risk, officers are expected to call an advocate hotline and offer to connect the survivor directly to an advocate on the scene. For the most dangerous situations, advocates with the high-risk response team will respond in person or virtually during the COVID-19 pandemic. We found that between September 2019 and November 2020, roughly 1,700 domestic violence incidents were deemed high risk through the lethality assessment. Only a portion of high-risk cases received a response from the high-risk response team. There were 45 responses between September 2019 and mid-November 2020. Currently, the high-risk response team is operating as a pilot program, which is expected to run through the end of fiscal year 2020-2021. Upon completion of the pilot, the city's advocate partner, YWCA, is expected to conduct an evaluation of the program. So we recommend the department work with YWCA in its evaluation of the high-risk response team pilot program, including assessing the criteria used to activate the team and reviewing the level of service provided to survivors and whether additional involvement with other agencies is warranted. Finally, in our last finding, we found that better data sharing will allow the police department to assess referral timeliness and other areas of performance. Both the police department and its advocate partners collect data that can be useful for assessing the timeliness and utilization of services. However, the sharing of data can be improved on both sides to allow for a better understanding of how well the current system performs. We found that YWCA's database shows it took the police department on average 3 days in June 2020 to provide YWCA with a lethality assessment from domestic violence incidents. Unfortunately, this information is not included in the data that is currently shared with the department, nor does the department track it themselves. Data provided on sexual assault advocate referrals is limited, and the department does not regularly receive data from its advocate partner Community Solutions for human trafficking advocate referrals. The department can provide domestic violence and sexual assault summary reports to YWCA to cross-reference against client lists to ensure all consenting survivors have been contacted as well. So we recommend that to better assess referral timeliness and utilization of advocate resources, the department should work with its advocate partners on what data can be shared between the agencies. Lastly, we found that data can help the department target outreach to educate the community about advocate resources. As shown on these maps, the number of reported domestic violence incidents and the percentage of survivors who agree to a referral varies across the city. So we recommend that SJPD work with community partners to expand outreach and education to targeted communities. So our report contains 6 recommendations. We'd like to thank the San Jose Police Department, YWCA Silicon Valley, Community Solutions for Children, Families, and Individuals, the City Manager's Office of Racial Equity, and Santa Clara County's Department of Family and Children's Services for their time and insight during the audit process. We ask that you accept the report and cross-reference the April 6th meeting of the City Council. And with that, I'd like to turn over to the Department for the administration's response. And I believe Lieutenant Jimenez will be providing the response. We will be available to answer any questions.
Yeah, so thank you, Joe Royce, for the audit. We agree with everything you did. So the department's response through Chief Tyndall is that we agree with all the recommendations that were provided. One of the recommendations actually been completed since the audit was conducted, and some of the duty manual revisions are occurring as we speak. I want to thank the YWCA for helping us get the I think it's recommendation number 2 across the finish line as completed already to standardize how referrals are provided to the YWCA through SAIU. Thank you, Cynthia Melchor, for providing us with the advocate referral link. That was tremendous in us being able to get it over to YWCA in a timely fashion. I know, Rachel, you had some input on that as well. But what that does for us is it allows us to refer survivors to YWCA relatively quickly upon receiving the information. So in short, the short answer is we agree with everything that was stated, and we will attempt to have everything done by the end of the year, if not sooner.
Great, thank you very much. And we will go over to our members of the public first for public comment. And first up is Paul Soto.
It is also it's very disorienting to hear all of that in my action. This is 100%.
Hey, Paul, your audio is coming in pretty bad. We can't make out what you're saying. Did you want to try?
Can you hear me now?
Yeah, that's a little better.
Okay. It's disorienting for me to hear all of this because my actual lived experience with the YWCA and the police department, all of that information is 100% false. It's just a lie. And so I received nothing. See, the point of contact, you can have all the rhetoric, you can have all the principles, you can have everything. But when it comes down to the officer contact with the person on the street, that is the point of contact that needs to be checked, because he classified that as a disturbance that it doesn't trigger those protocols. So he felt that he doesn't have to do anything. In that circumstance, where a man is being evicted as a result of his response to being sexually assaulted while he's wearing a towel, and to say that, well, I'm not going to believe you, I'm going to tell you that you misunderstood, that is an enormous amount of power for an officer to exercise. That's number one. Number two is that the YWCA they responded not at all. Now, the lady that initially talked to, she was very kind and she got it. She understood the PTSD issue that was triggered. And I don't want to keep telling this story over and over and over again, because you relive it, the PTSD inflames again, and boom, it takes me like hours to calm you down. But I can tell you for a fact, no one from the YWCA has contacted me. They know that I'm homeless as a result of that, a result of being a victim of a sexual assault. Nothing.
Thank you, Paul. Next up is Blair Beekman.
Hi. Sorry for what Paul's going through with this issue. It's my personal feeling that I was going to try to offer something a little bit more hopeful or optimistic, but that it's my personal feeling that there are glimmers of hope of how you guys are working on these issues, and things in a year have since May, have actually started to make a few changes. And that is hopeful. If not changes, then you're considering and you're forming. And, I think in the next few years and by 2025, we can maybe, it takes time and we can be on a good track, I think, hopefully. So thank you for this report. I was a bit concerned that your words, the last meeting a couple days ago about overtime issues. You explained your position, where you're coming from with the issue. It was nice that you did that. Hopefully that is a way to work on it, because I think we're going to have to work on that one. Excuse me. And yeah, this, like I've been trying to say the past week, the city of Oakland, I mean, all of Oakland, its entire community are working on efforts of Reimagine right now. Berkeley has been doing some interesting ideas that I think in the next few years, we're very, steady and educated here in the South Bay. I think we're going to learn some important lessons in what they're doing there at this time. And, if we're open to what they're doing, there's something real hopeful and positive in that. And good luck with your own efforts with these issues at this time. And thanks a lot.
Okay, thank you, Blair. I'll go back to my colleagues. Don't see any hands raised at the moment. So I just have one question. And oh, there we go. I'll hand it over to Councilor. No, okay, I'll ask my question first.
Go ahead.
Okay, so just one question. And appreciate the report and the response from our police department. There will be progress there. I appreciate that. I just had a question in regards to the domestic violence resource card. And I know that we, even in our report here, there's sort of a mix of language of victim and survivor. And there has been I think some progress over time with that, moving from the terminology of victim to survivor. But this particular resource card still has that terminology of victim throughout it. I'm curious, is that a county card, or how is it something like that card that it could be updated?
Right, so that's one of the difficulties here with this card is it is a county card. We once we received the preliminary report, Lieutenant Lang reached out to James Gibbon Shapiro, an ADA over the Santa Clara County District Attorney's Office. I was CC'd in all the correspondence, and we are working with the county to update these cards and all the issues that were presented by the auditor and more. I will bring that other question up to James Gibbon Shapiro as to whether or not they're open to changing the term victim to survivor as well. But James Gibbon Shapiro was very receptive of our request, and he wants to prioritize this moving forward. I think there's another meeting that they're having with the county at a larger level that he wants to bring this specific issue into. I know Lindsay Mansfield, you nod your head in the affirmative. I don't know if you have some more stuff to add, because I know you're very aware of this as well.
No, nothing to add, but I do think that there's support in the county for that. I also think that just in terms of language, I think that different people feel different ways. Some people do identify with the term victim. Some people identify with the term survivor, and some people don't identify with either. So I appreciate the efforts to move towards survivor. I just want to highlight that we're always going to have some differences in how people identify.
Okay, great, thank you. And this could be something that we discuss at our joint meeting as well. Okay, that was it for my questions. Councilmember Arenas.
Thank you, Chair. I'm going to start out by just thanking Joe for providing his response and his work so quickly. I'm really grateful for that. One of the things that I wanted to add, sorry, I'm looking for my notes, was under, and this is in the at the end of the audit, in the chief's response to the audit report, and this is under recommendation 5. I'm sorry, to better understand the timeliness of referrals and utilization of advocacy, as well as to further ensure survivors who receive a referral are accounted for. Work with YWCA to determine what data should be regularly provided to the department for domestic violence and sexual assault survivors, as well as data on high-risk response team. And then the following is ensure the YWCA provide a report of all domestic violence and sexual assault survivors who consented to referral on a monthly or regular basis. And I wonder, I know that you included some additional service providers in other recommendations. I apologize, this is recommendation 4. And I wonder if you would also be open to having an MOU with Nextdoor or well, Community Solutions is a bit more on human trafficking, but maybe Nextdoor to also share that list, so that way, you know, if YWCA has a wait list or, you know, it just is greatly impacted, that we have an alternative as well for our folks.
Yeah, thank you for the question, Council Member. And actually, we do have a MOU with Nextdoor that is being worked on by the city attorney and being reviewed by the city attorney. So we are looking, we did talk with Y just to make sure and take a look at the services and make sure there's no conflicts from that standpoint. So really at this point, we're just working through the different language and getting that put in that place. Because as we know, as many services as we can out there for victims or survivors is the best case scenario. So we are working on that.
Wonderful. And I know that was, you added, or you're going to add next door under recommendations 6 to expand your community partners for outreach about advocacy services and crime prevention, targeting communities who are disproportionately affected. And so what I'm asking is if we could, in that MOU, include them also as the folks who receive that list for survivors who have consented, that referral list on a monthly basis. I think that's what it says. So as you're doing that MOU, could we include them also to be recipients of the list of referrals that you're going to begin providing to the YWCA on a monthly basis? I don't know how the service providers will handle that, but I wonder if more is merrier, seeing that there might be great impact in a waiting period for folks. And if we miss that period where people are encouraged to call and connect because there's a wait list, that we might lose them, right, until somebody else reconnects them.
We will certainly look into that and adding the language to it. And again, we'll work with the Y and internally just to make sure there's no conflicts there, but we should be able to work that out.
Perfect, perfect. Thank you so much. And then the last thing, I'm sure that you've already are thinking of this. Obviously, you know, Lieutenant Jimenez is going to be co-located over in the Child Advocacy Center that will be newly established, hopefully by the end of the month. I'm going to knock on wood. We've been waiting for this for a really long time, and I wonder if you would also be willing to, for those victims of sexual assault, include them in this outreach effort, in coordinating with the Child Advocacy Center.
So I think I'll take that one on, Chief. Yeah, so we should be on the 29th be co-located with the county over at the CAC rather than the CAC, and there will be service providers there as well. YWCA is one of our big ones, and that information should get dispensed, and that would be from the age group of the minors, right? The people that are 0 to 17 years of age only.
Right. Just to include minors.
Right. So yeah, it sounds like from talking to James Shapiro that those types of things are in play for the CAC, and they're expanding service providers as well.
Perfect.
More than we have.
Thank you. I appreciate everybody's efforts on this. Once again, motion to approve. Really proud of the work. Thank you so much.
Second.
Okay, great. Thank you. We have a motion and a second. No other comments. We can get a roll call vote, please.
Jimenez,
Yes.
Mahan,
Aye.
Jones,
Aye.
Arenas,
Yes.
Peralez.
Aye.
Thank you.
Okay, thank you. Motion passes unanimously. Now, let's see here. Getting to the right page. All right, this takes us to item D4, Suicide Prevention Policy Annual Report. And I believe I'll pass this over to Lee Wilcox.
Actually, council member, I'll be presenting today.
Sarah Zarate from the city manager's office.
Yeah.
Okay, sorry, I was looking for whose name popped up there.
Thank you, Sarah.
Okay.
Thank you.
Welcome, Sarah.
Thank you. Good afternoon, council members and members of the public. My name is Sarah Zarate, assistant to the city manager, and I'm joined by Carolina Camarena, director of communications in the city manager's office, and Allison Suggs, assistant director in the Office of Employee Relations. Since this is the first annual report for the City Council's suicide prevention policy, I want to provide a little bit of context. At the March 2019 City Council priority setting session, Council discussed a memo authored by Councilmember Perales calling for the city to develop a council policy on suicide prevention, similar to that of the City of Palo Alto. At that meeting, the city manager greenlit the memo, and we returned to council with a council policy in March of 2020, and it was unanimously passed. The council policy is aligned with the Santa Clara County's 10-year suicide prevention strategic plan, which aims to advance a number of efforts, including, for example, implementing and coordinating suicide intervention programs and services for targeted high-risk populations, and implementing a community education and information campaign to increase public awareness of suicide and suicide prevention. As the county is the public health lead in this area, the council policy is really meant to amplify the work being led by the county by building issue awareness and reducing stigma associated with seeking help, promoting help seeking, and increasing awareness of resources. The City Council policy is made up of 4 components that target city employees, city facilities, city residents, and coordination with outside agencies. And it requires certain actions related to these groups, all of which have been completed over the last year and have included communications with our current employees, retirees, and city residents. Those communications have included the Santa Clara County's recently published 2019-2020 Suicide Prevention Annual Report, several suicide and crisis service resources, and for our city employees, information for our City Employee Assistant Program. Additionally, our standard operating procedure was reviewed, which informs of internal city actions that would be taken if an event at a city facility occurs. Lastly, and importantly, I want to highlight our collaboration with the county around this issue, both in creating the policy and its implementation. Mago, who is the program manager for the county, helped review the council policy when I was drafting it to ensure that it met the spirit of their work, and she provided me with resources for inclusion and research in that policy. She also helped coordinate a training for our public information officers around safe messaging, which was conducted by the county last fall. Also, because of this partnership, the city was able to amplify their COVID-19 suicide prevention public awareness campaign, including sharing a community survey that will help shape their future efforts. I do have preliminary data from them on that campaign that provides total impressions and landing page visits if you are interested. The survey evaluation should be complete in about 3 months. Lastly, we started engaging in the county suicide prevention oversight committee that meets bi-monthly, and we look forward to future collaboration with the county and the advocates through that forum. Over the next couple of months, we will provide additional communications during Mental Health Awareness Month in May, as well as additional information related to suicide prevention, a suicide prevention conference that is planned for May. I also just received an email while we were in this committee from one of the Oversight Committee members asking us to also highlight July as Minority Mental Health Awareness Month. We'll work with that Oversight Committee to learn more in case there's any campaign efforts that are happening on that effort in July. And lastly, I would like to thank Council Member Perales for his leadership on this issue, and we look forward to continuing to bring awareness to city staff and the community at large around suicide prevention in the future. And that concludes the presentation. We're happy to take questions.
Thank you very much, Sara, and really appreciate your work on this and the update coming back to committee here. We will go over to our members of the public first. And first up, we have Paul Soto. And Paul, can you hear us?
Okay, yeah, now I can. All right,
Go
thank
ahead.
you, Councilman Perales, and thank you for doing this type of work, because there's a causative effect between the suicide rates and gentrification. And here's why. It's because suicide is the ultimate exercise of control for those who have none. Now, this is the psychology behind suicide. I'm very familiar with suicide. Growing up in juvenile halls and institutions, I have been witness to literally hundreds of suicides, the bodies coming out of the cell. I just, sometimes it frustrates me because I'm sitting on a body of knowledge and a life experience that I'm trying to avail it to my community as much as possible. And it's almost scary sometimes to hear the way that society perceives the lived experience and what the lived experience is actually like. There's like a gulf between them, large. And what my duty is as a citizen, as a Chicano, as somebody that I fall into every single one of those categories. Right now, in the situation that I'm in as a result of that contact and that eviction with the police officer as a result of that sexual assault, I am primed for this. I have suicide in my background. I've been around suicide. Basically, using drugs and alcohol is a means to stave off the suicide because it's an exercise of power for people that have none. When a person feels like they are in a position where they can exercise no powers in order to affect change within their lives, they exercise the one power that they have, and that is to take their life. That thought process is going to accelerate exponentially over the next 10 years in this city, guaranteed. And that's why I do what I do, is to put it on record, to make my city know, so that the future, when the future looks back on this time, they can say, hey, there was this one dude, man, that people thought he was nuts. No, he was telling the truth.
Thank you. Thank you, Paul. And for the record, I don't think that you're nuts. And in fact, as you know, we've let you know, we truly do appreciate having your voice and your perspective in these meetings. So please continue to join and share. Next up, we have Vic, I believe, Ojekian.
Can you hear me?
Yes, we can now.
Okay. I just wanted to call in and thank you for having this annual review. I remember when you passed this policy because there was a different public health issue that preceded it on the agenda that day. And that was maybe your first discussion on COVID that was happening. And it struck me as interesting because a lot of people don't understand that suicide falls within that same rubric of public health matters. The difference is hopefully we get past COVID because we have a tangible item, a vaccine to cure it. But with suicide prevention, there is no vaccine. With suicide prevention, our main weapon against it is awareness. And so it requires all of us to do something. And the fact that the council was willing to pass a policy and disseminate information and do some tangible acts, in the end will be a very helpful thing. Just for all of your knowledge, because I think all three of the council members that I can see on my screen all voted for this policy. There are other cities in the state of California, we're talking with some of them now, that have recognized the fact that San Jose passed a suicide prevention policy, meaning it's not an abnormal or an unusual thing to do. And we've got over half of the cities in Santa Clara County with policies now. So I'm grateful to you, Chair Perales, for your persistence on this issue, but I'm also grateful to your colleagues for passing this item and continuing to do work in suicide prevention. Thank you.
Thank you very much, Vic, and thank you for your support prior to getting this policy passed, especially knowing your personal history and experience with this. So thank you very much. Next up, we have Blair Beekman.
Hi, Blair Beekman here. My best friend committed suicide about 25 years ago, And, I've tried to say before, some of the ideas that we used to think about and talk about, I can now bring up here, and it's nice to be able to do that. To offer a broad position about suicide, overall suicide ideas, it's not everything, but, with the events of 9/11, starting about 2006, 2007, the U.S. made a big push to start gun sales and gun trafficking throughout this country in North America. It kind of took over the market, basically. With the ideas of COVID, with, and just those sorts of issues. I mean, these are issues of state violence and extremism, basically. And it leaves us as everyday people a little bit overwhelmed, and we don't have very many options sometimes, it feels like, I feel. And I feel like we're just learning with the ideas of equity, reimagine, my own open public policy with technology work. These are real important ways that the everyday public can get a handle on how we deal with our future lives and our future situations. I mean, what we've talked about here today and the work that I do, important work that's going on in Oakland right now, we are addressing how as a community we can end, a serious systemic violence that's going on because of our past 20 years of what we've created. We've created a monster and a mess and a zoo, and we're trying our best to create plans and practices to address that. And it takes our whole community, even those parts of the community committing these problems, to see what's possible at this time and what we're building. Thanks.
Thank you, Blair. And last up is Kathy Trent.
Hi, can you hear me? All right. Well, thank you. I just wanted to echo what Vic was talking about and just express my gratitude and thanks for the City Council for your leadership on passing this this memo and policy and the work that the staff has been putting into to follow like the county guidelines. I think it's so incredible that San Jose is able to be a leader and be a model for other cities to follow, especially when this is like a public health crisis that's going on. And like with COVID happening, sometimes we can feel more isolated than ever, but it's great for our city to be able to have these policies in place that will help our residents with, whatever pain that they're going through. So I really just want to say thank you. And I really appreciate the work that the staff are doing. Thank you.
Thank you, Kathy. And thank you for your persistency as well. And to you and Vic for continuing to show your support even today as we're getting the annual report back. So really appreciate that. Okay, I'll bring it back to my colleagues. Don't see any hands at the moment, so I'll just jump in with a couple questions. And so looking at how we've been disseminating the information, I just wanted to make sure that we can disseminate these resources to all of our council offices so that we can be able to promote those, whether it's through our newsletters or out to the community as well. And I wanted to see if the city could obtain data from the county for where our most impacted and at-risk communities are located, so that we can target these resources.
Thanks, Council Member. Absolutely, I'd be happy to follow up with the county and get some more geographic targeted information and also maybe some demographic information. I do know that in their recent survey and campaign, they did target information that was culturally specific to Hispanic males, knowing that I believe it's middle-aged men were at higher risk, and they wanted to ensure that both populations were being served. But I will be happy to follow up on that.
Great, thank you. And then as the report noted, seniors 75 and up still had the highest suicide rates back in 2018 at least. And I wanted to see how we are specifically reaching out to those populations, for instance, utilizing programs that serve seniors, like our senior nutrition program. And obviously we all look forward to getting back in person with those, but obviously seniors have still been receiving meals and stuff through the programs, but wanted to see if you can answer that as well.
I can certainly reach out to the county's manager for suicide prevention to better understand how they target messaging for that community. Is Carolina on the line? Great. Carolina, I don't know if you want to speak to city efforts.
Sure. Councilmember, I think that's a great idea, and it's something that we can certainly follow up on, and we'll complete.
Okay, thank you very much. And in regards to the schools, what I noticed was that not all school districts in San Jose are participating, and it just so happens the two biggest, San Jose Unified and Eastside, are not. And so, can we help ensure that school districts within San Jose are aware and that we can get them to participate?
I can bring this up as an item at the next Oversight Committee and try to better understand how we can be an advocate.
Okay, thank you. Yeah, just considering the sheer size of those two, they're covering the large majority of our students. I want to be able to see if we could at least make them aware, see if they can't receive some of the resources, and then ultimately be able to promote and then participate as well. And I will do my part as well to try and ensure we can introduce at least the program with the school board members that I am in contact with. And then just lastly, thank you for the progress. I would agree with the comments from our members of the public on certainly just the influence that we can have here in the city of San Jose, and I think that we've already had in the progress that we've been able to make. So thank you for that. And I do see some of my colleagues want to speak, so I'll turn it over to Councilmember Mahan.
Thanks, Chair. I'll be pretty quick. Your first question was the same as mine. Sarah, thanks for the report. I was also interested to learn a little more about what the data is saying about the most at-risk populations, and then how our council offices can maybe support that sort of targeted outreach. So it sounds like you're gonna circle back to us with more information. Is that right? Okay, great. Okay, cool. Thank you. And then, and by the way, just thanks for the report and the great work on this. And that actually goes for all the reports today. I've been learning a lot, and all really important public safety topics. So the other thing that I was trying to wrap my head around was the sort of, it seems like we're doing a lot, we're trying to reach people in a lot of different ways, which makes sense. The county report, I noticed at the end in their recommendations, the final recommendation talked about improving evaluation measures with a focus on measuring outcomes and trying to, at least the way I read it, was trying to understand where our limited programmatic dollars can have the biggest impact. And I was curious, I guess, A, what have we learned to date, just for my context and anybody else who doesn't know, about kind of what outreach programs are most effective? And then maybe B, can we include, as the county says that if that's a priority to invest in, as they come back, can we be sure to include that in our report next year so that we're actually learning as we go? It would be helpful for us to just over time kind of understand what we're trying and what seems to be working, and how that's being measured, basically.
Thank you, Council Member. That's something that I would be very happy to follow up with them. Obviously, from a public health perspective, they're the lead agency, and they're trying to impact population level metrics. So I know that it can be challenging when so many different partners are helping support those efforts. I do know that as part of their strategic plan, they do have a data working group. So I can get a better sense from their program manager on what they've done around this particular recommendation. And I'd be happy to bring back any information related to the outreach that's most effective.
Great. Awesome. Thank you. And if, Chair, I don't know if you want to entertain a motion, but I'll happily move to accept the report.
Second.
Yes, thank you very much for that. And thank you for the second. And then go to Councilmember Arenas.
Thank you, Chair. So I have a question on page 4 of the report. You have a brief description of a comparison between January through August of 2020, and you compared it with 2019. And then the recognition there was that there wasn't an increase, a jump between those two years, that was pretty flat, which really surprised me. I don't know, maybe anecdotally people have been sharing stories, and that's, you know, or that's what rises to the top in terms of news stories. But I wonder if maybe if the figure is the same, could it be that the category of people have shifted? Maybe it's younger kiddos, or, you know, junior high kiddos. I know Councilmember Perales talked earlier about 75 and over being the highest risk, or those in that category. So I was just wondering if maybe we could break it down a little bit more to understand. And I you know, this is in line with what Councilmember Perales was asking in his first question as well, for a bit of more demographics, and a true comparison between 2019 and 2020.
Thank you, Council Member. The information, the data that was shared in the staff report does come from the county. So they do control both the data and its evaluation. I would be happy to reach back out to them and ask about that. I do know, however, that the analysis of suicide data is always lagging by a year or two because it's connected to the medical examiner's office or the coroner's office. So right now, they only they made statements in their annual report related to preliminary analysis, because really it's not complete until all of those have gone through the medical examiner. But yes, I would be happy to reach out to them and better understand what the distribution of the demographics are, and if we could get more specificity around geographic location.
Got it. But it sounds so far from January through August, that is a rate that was caught up with the examiner, right? So it can't. Those folks did their job and gave and forwarded that statistic, I'm guessing. So it's not a preliminary. This is a final count.
I followed up with her on this particular data set, and she said it's very hard to say whether or not the count is final. That's why it's always lagging by about a year. So it's hard for me to speak on it because I'm not connected to the data set.
Okay, so this data set isn't final. Okay, thank you so much, Sarah, and thank you for the work that you're doing. I really appreciate this. Councilmember Peralez's leadership in this, and everybody who takes part in it. I know that our kiddos are definitely impacted. Their mental health is impacted in a way that we haven't lived through, right? We just don't. We understand what it means to be isolated, but when you're a child, those stressors really change the way that your brain develops, and it changes the way the receptive and sensitivity of stress for the future. And so I'm glad that you're doing this, and we're going to keep this on the radar. So thank you.
All right. Yeah, thank you. Thank you to my colleagues, and yeah, thank you, Sara, as well, and to our city staff. I think this happened to be prioritized just at the right time. We know we've had a lot more people this past year experiencing mental health crises, and unfortunately, suicide attempts went up. And so it's just really important work. And so thank you for that and appreciate the update. Okay, we have a motion and a second. If we can get a roll call vote, please.
Jimenez,
Yes.
Mahan,
Aye.
Jones,
Aye.
Arenas,
Yes.
Perales.
Aye.
Thank you.
Okay, thank you. And then before we go to open forum to close up the day, I do want to welcome our brand new attorney from the city attorney's office, Rosa, and I will give it an attempt. You can tell me if I'm pronouncing it correctly, but Rosa Sang Tatari. And we welcome you now being permanently assigned to PISFIS, and you can say hello and also help me with the correct pronunciation of your last name.
Hello, and that was a pretty good pronunciation. So I'm really looking forward to staffing this committee. I had looked at a few of your meetings prior, and it's good, meaty information and work that you do. So thank you.
You're welcome. Yeah, thank you.
And Chair, could I request for Rosa to actually say her last name? Because I'd like to hear how it's actually said. I've been wondering that this whole time.
Well, you can say it multiple different ways. And when I was learning how to spell it, it was kind of like Mississippi when you follow the bouncing ball. It's a hyphenated, it's a merger of hyphenated of a Chinese and Tahitian last name. So the first part of it is actually Zong, which is T is silent, the S has a little bit of that Chinese emphasis, and Tatari is from Tahiti. So when I say it together, it's Song Tatari, but Song Tatari is fine too. However, Rosa is fine.
No,
thank you.
We can handle Sung Tatari, so it just, you know, we have to. Well, thank you, and we're really pleased to have you on our committee, and we do strive to always hit the limits of the 5 p.m. hours. So hopefully you clear the calendars on PISFIS days. Okay, we will now go over to public comment, and first up is Blair Beakman.
Hi, thank you. Sorry, I did not complete my thought in my last public comment, and it is simply that, you know, with such good practices we have that we're developing at the local level, you know, it's really good stuff. I think it can address the issues of suicide really well, and the issues of gun violence, and the issues of, you know, mass shootings. I think it is imperative that what we're developing at the local level, that everyone can be invited and included, and it's a hopeful process, what we're doing. Thanks. Yeah, I didn't want to be down-spirited, but it's something can be hopeful from what I think is, I gave a pretty factual understanding of what we're dealing with. The city, to conclude with, I wanted to make a really nice speech, but I only have a short amount of time here. The city is currently being sued by our Better Community Advocacy at this time for the way the George Floyd protests were handled last May and June. I think it would be the healing, it would help the healing of our community to go over exactly what was Deputy Mata's role and decision-making at the time, both openly and privately, and learn to ask him what changes he would possibly make and where we could all become more clear with what can be definitions of peaceful assembly at this time. Because for the most part, people in San Jose want to peacefully assemble. To conclude, to address ideas inside of worries, is there a way to develop an open communication process between SJPOA and the community, and perhaps public oversight for questionable SJPD neighborhood association ideas and practices? And I hope that new Chief Mata in the future will want to learn and always want to pass along the ideas of good community technology and accountability practices, along with technology questions. Thank you. I will talk more about this subject next week. Thanks.
Thank you, Blair. Okay. And Paul Soto, you'll have the last word.
Thank you, Councilman Perales. I'd really like to thank Councilwoman Arenas for talking about the psychology and the actual biochemistry changes that happen to children that experience that isolation as a kid. I'm one of them. From 12 to 18, I didn't have any breaks in juvenile hall. And this was at the time when you could still hit your kids on the street. So what do you think that the juvenile hall counselors were doing to us in there? And this was labeled justice. This is what society called justice. And so, and this is ancient. The Dominicans, the Franciscans, and the Jesuits knew how to exercise torture. That's why they were such excellent colonizers. They knew how to go into the areas and just completely break the psyches, break the identity, break the culture, and then insert and infuse them. The philosophy of the Carlisle schools was kill the Indian, save the man. This is a philosophy that established the United States. It needs to be reckoned with. It needs to be talked about. It needs to be accepted, and just restitution to the human beings that have suffered generationally under these policies needs to be respected. I have in my life experienced all of that. Cut off from my language, from my mother for her being beaten in San Jose Unified School District. I cut off from society because of the tabs, police, the school to prison pipeline. I'm a victim of that too. And one of the ways that I dealt with that was alcohol. Alcohol is suicide on the installment plan. Alcoholism is suicide on the installment plan. So this is where we need to really have a conversation about this, because a lot of high-minded people who think they know what they're talking about because they have a bunch of degrees and they have assumed positions of power and influence that somehow or another they are an authority. If that's the case, then why are certain people consulting me on what I know to be true? And they know that I know what I'm talking about, but yet I'm suffering. I'm being evicted because I'm a victim of a sex crime. I'm being tossed around by the agencies that collect millions of dollars, and I still receive no help.
Thank you, Paul. Okay, and that'll end our meeting. The meeting is adjourned. Thank you.